Hello, my name is Allison Warner, and I am the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know to keep the orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 30 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene, and she has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Hi, Jackie. It's good to see you again.
Hi, Allison. This is the week after Thanksgiving,
Mhm.
so it's time for us to get back in the sterilization room and look at what's been going on.
Yes, and so we're actually going to tackle something that's created a bit of confusion for the orthodontic practice, and that's the OSHA Infectious Disease parentheses COVID-19 Preparedness Plan. Practices already have their OSHA manual. So there's the bloodborne pathogen standard, hazard communication standard, and the general safety standard. So they're familiar with OSHA's requirements. But now they're being asked for an additional document, this infectious disease preparedness plan. And I think what is causing some confusion, because I was even confused when we started talking about this, is that practices have already been implementing their COVID disease protection protocols, from their PPE requirements and triaging patients to implementing social distancing and barriers between chairs. So now they're being asked to just put this in writing, basically, to write a plan. So as with all OSHA standards, right?
Yes, you're
Okay.
you're exactly right, and it has been very confusing. I think the information has risen to the surface because there has been so much publicity about OSHA fines
Yeah.
to businesses, all businesses, not just dental or orthodontic offices, but even retail stores like Target and the grocery store and manufacturing facilities, that they need to have this infectious disease preparedness plan, and OSHA's going in and inspecting facilities and issuing fines,
Mhm.
and substantial fines
Yeah.
in the last 3 to 4 months during the pandemic. And so there's a lot of questions about, well, what is this preparedness plan? And many orthodontic team members think, well, we have that written respiratory protection plan.
Right.
We talked about that several episodes ago in the
Exactly.
sterilization room, but this
Yeah.
is different.
Yeah.
This is a preparedness plan in response to the airborne disease transmission for COVID-19.
Mhm.
And it's comprehensive. It has to look, that plan needs to look at the entire workforce. And we're going to talk about the orthodontic office, of course,
Mhm.
the entire team, both the front desk, the laboratory, the clinical chairside assistants. What protections do we need to put in place for them? And what has the orthodontic team been doing to reduce the risk of acquiring an infection? And OSHA published a booklet, very
Mhm.
specific. It's commonly referred to as the 3990 book. And if you'll put up on the screen the cover page and the hyperlink or the website link to the OSHA booklet, and it's the guidance for preparing workplaces for COVID-19. So just by the title, you can see it's not just for healthcare facilities, but for
Mhm.
all workplaces.
Right.
So OSHA's looking at all workplaces with this airborne disease transmission that we're all wearing masks for now, and saying, what do you need to do in your workplace to
Mhm.
protect your workers? And many of us who've gone to the grocery store, even right after the March 16th closures, the grocery stores immediately put up the plexiglass sneeze guard, and they had hand wipes, and they were disinfecting all of the grocery carts. And we had never seen that prior
Right.
to the pandemic.
Mhm.
Well, that was part of their preparedness response. And it was the recommendations from CDC about how could we reduce risk and risk of acquiring an infection. Now OSHA wants all employers to have a written preparedness plan outlining what have you done to make it safe for your workers in your environment, that
Mhm.
they are not at high risk of acquiring this infection. Now, this preparedness document, the guidance, is a large document. It's about 40 to 50
Right.
pages long.
Yes.
But where they need to get down to is pages 7 through 17.
Okay.
That 10 pages gives them the core elements that they need to include in their orthodontic preparedness plan. So it's really what they've already done. We just
Mhm.
have to write it out in simple language about what you've done in your orthodontic office for that preparedness plan.
Okay. Well, let's get into the specifics then. So what does the OSHA booklet lay out? What should they be doing?
Well, there are 8 bullet points that I'm going to outline for you that are in those 10 pages that we talked about. And the number one is, first of all, to provide employees with training on COVID-19, on the SARS-CoV-2 virus, how it's transmitted, and what increases your risk of infection. And then what are the signs and symptoms of the disease? So most of us have attended the webinars sponsored by the AAO
Mhm.
on the disease and the disease transmission. And we covered several of these in our previous episodes, the earlier episodes of In the Sterilization Room. Number 2 on the bullet point list is to identify your employee's risk. Now, that's not just the general risk, but what's the risk for each individual employee? So if you have a receptionist working at the front desk, then their risk is going to be as patients come in to make appointments. And the safety precautions that you've put in of having that sneeze guard, them wearing, say, a level 1 mask,
Mhm.
protects the employees from that risk. Another risk for employees is going to be their community exposure. Their children are going to school,
Mhm.
participating in athletics. So they could be at a higher risk if they have 3 or 4 children at home that might test positive, be symptomatic, or their spouse could be infected. I know we had a complex situation with one orthodontic assistant where her husband was an EMT. Well, being an EMT, he was at a high risk of exposure and
Mhm.
acquired an infection. And during the early stages, she stayed at home for 14 days to isolate with him and didn't develop any signs or symptoms. However, his employer would not allow him to come back to work until he tested negative.
Mm.
Well, in the early stages, the CDC had not identified that the patient would be non-infectious. However, they could still test positive because of the sensitivity of the PCR test. So it got a little bit. So that's the community exposure with it. And then the other risk factor is for the employees. Do they have any chronic illnesses?
Mm.
Are they of the age group that is at higher risk
Right.
for acquiring an infection? And I know, again, in one orthodontic office, we had one administrative team member that was going through some chemotherapy for cancer. And she was very apprehensive as we reopened the practices about returning. And they were able to set up a closed room for her with an air purification unit in that room. And she even ate her lunch in that room so that she would not be exposed to patients and the clinical team
Yeah.
as other people were flowing throughout the
Yeah.
office. So
Okay.
that's where the OSHA is saying identify what your employees' risks are. If there are unique hazards, then you may want to make allowances or put in special precautions.
Mm. Okay.
Number 3 is OSHA outlines basic infection control. And I'm going to go back to the grocery store. The grocery store had never disinfected carts before. In the ortho office, we've disinfected every surface for years. We've
Mhm.
got in standard precautions down, which is part of the written exposure control plan. That's how you implement all the bloodborne pathogen safety issues.
Ah.
So refer back when OSHA says identify the basic infection control and educate the employees on it. That's going to be your written exposure control plan. So you've already got that in your OSHA manual. Just
Oh.
write that back in there. And then that it sounds like it's going to be complex, but you don't have to recreate the wheel. Use the basic infection
Okay.
control plan. Now, the next one, this again gets back to what are you already doing? You're doing it, so we just need to write it. It's OSHA states to have policies to identify and isolate sick people. Well, the ortho team is taking temperatures, asking, do you have any signs or symptoms of the disease? Doing that triage and keeping records for both patients and employees every day.
Mm-hmm.
So that's what we've done. In addition, they've also, as they confirm appointments and send out those text messages and those email reminders, they reminded their patients to wear a mask when they come in. And if they have any signs or symptoms, please let us know. We'll reschedule your appointment. until you don't have that fever or your symptoms are reduced with it. So that's what we're doing currently. You just need to write that up with it. And if you want to include as a piece of documentation with it, I would include the ADA's COVID-19 risk assessment. That's that one-page flow chart that you go through the algorithm on what you need to do if you're exposed to COVID-19. So that would be a document that you could include with that segment on your written response plan. Okay, we're going to go right on along. And the very next topic is one that is confusing and it's challenging because it's going to be different for every orthodontic office. And that's what work practice controls have you put in place. So we've already listed the sneeze guard at the front desk. And next we're going to look at the heating and air conditioning system, the filtration that's provided for all of the air in the orthodontic office. It's been identified that for healthcare facilities that the heating and air conditioning system should provide at least 6 air changes per hour. So hopefully during the pandemic, you've had a consultant, an engineer come in and look at your HVAC system. And if it wasn't providing that 6 air changes per hour, you've made upgrades in the system, and you've put a higher filtration system in there, where maybe you just had a dust particle filter that now you've put in a HEPA filter or a filter that provides a MERV rating of 13. That's recommended for, again, healthcare facilities with it. And the ortho offices may have made other changes to their HVAC system. And where we've had open bays in the orthodontic office, well, that allows free airflow in between the chairs. Installing barriers in between can reduce that airflow, adding air purification units that again would help filter out any particles, and maybe even including UVGI irradiation. The sneeze guard up front, and even where we've talked about, we looked at Boyd Orthodontics, and Dr. Richard Boyd, he was able to put in a negative air pressure room. He took one room that was not being used, that was adjoining to the clinical area, installed a glass wall with a door, put a ventilation system in, and then extra oral suction. That's another part of your work practice controls. So every ortho office hasn't implemented the same work practice controls, but what you have implemented, put those in to your written response plan with this as part of your mitigation, your aerosol mitigation with it. And then administrative controls, that's the next bullet point. And it's where you talk with your team members about if you can avoid large gatherings. Don't, go out where you're going to be together with a lot of people, and especially unmasked. It's part of our responsibility as healthcare professionals that we are wise with our social exposures, and don't travel to areas where there's a high infectivity rate. Especially in states where there's a high infectivity rate, and most international travel is severely limited at this time. I mean, even because we have such a high infectivity in the United States, there are limitations on going to other countries if you're in the United States. And then the other part of that is looking at if we have to close our offices again, what's going to be your emergency contact or communication? How do you let other team members know, are we coming to work today, or we've shut down, or we found out, I had a situation where the doctor found out on Friday afternoon that her receptionist at the front desk husband had tested positive. And at that point, the receptionist went for a test and she tested positive. She was asymptomatic. So over the weekend, the doctor was having to deal with, do we all need to quarantine at home? Can we come in? Does everyone need to get tested? And she was going back and forth with the CDC guidance, and that happened to be a Florida office. So what's the Florida Department of Health recommending? So how do you do these emergency communications when the office is not open? How are you going to communicate? And if patients had to be canceled, how are you going to communicate with your patients? Do you establish a Zoom meeting? Can you send out emails? What's going to be your communication method with it? And then finally, under the administrative controls is the PPE that you would use and how to use that. And
Mm.
it's going to be different. We all think N95 respirator right now when we're
Right.
thinking about PPE, but you know, the front desk team, they're using level 1 mask. So how do they put them on? How do they take it off? What's appropriate for different areas? What's the PPE that you're going to use when you're doing non-clinical procedures? So
Mhm.
all of that information needs to be part of your written response plan. And then the next one we get down to, number 7 on the list, is safe work practices, hand hygiene. Oh my gosh, the team is so good. And wearing normal PPE, that isolation gown, the surgical mask, safety glasses. And then who wears N95?
Mm.
Determining when you change from a surgical mask to the N95 respirator is determined by the procedure you're doing. If you're doing an aerosol generating orthodontic procedure, then you're going to wear an N95.
Right.
Otherwise, you can wear that level 2 or 3. And if you're in crisis shortage period, then you might be reusing it and adding that extra face shield to prevent the bulk contamination
Mm.
as you're having to reuse those level 2 or
Right.
3 or the N95. So knowing about what the face shield is with it. And then finally, number 8 is OSHA says follow all other standard OSHA safety
Mm.
precautions. And that's what
Okay.
we've talked about, the hazard
Okay.
communication, general safety, and of course the bloodborne pathogen. So
Mm.
that's basically what's in the 8 elements that needs to be in your written COVID-19 response plan. It includes the respirator protection that we've
Yeah.
talked about with how to use N95 respirators, what type of training to provide, fit
Mhm.
testing, and the medical evaluation.
Yeah. Okay. Well, that is a lot of information to take in, but are there any other additional resources that orthodontic practices can seek out as they're writing their OSHA plan?
Well, the AAO has been so proactive in providing resources on all of the concerns for orthodontists and how to navigate safely through the pandemic.
Mhm.
And I'm proud to say that yesterday, the AAO recorded their annual OSHA webinar that I've been privileged to provide for over 10 years.
Oh,
Every
wow.
year, we do an annual update in November or December, and we scheduled it
Mhm.
for December the 1st this year. It will be posted in the online library by this Friday. So they'll have a hyperlink to it, and it goes into all of the OSHA safety precautions that need to be taken during the pandemic, provides training for the orthodontic team, and goes through this COVID-19 response plan. So I would highly encourage that every orthodontic team member view this and use that as part of their annual OSHA training and OSHA safety update. And of course, the first concern has been this year all of this new information of having a written response plan. What do we need in our OSHA manual? So you've had the 3 other tabs in your OSHA manual that were the bloodborne pathogen standard, hazard communication, general safety. Now you're
Yeah.
adding the 4th tab, respiratory protection, the COVID-19 response plan that's going to be in your OSHA manual. So
Mm.
I'm hoping this information and the resources will make it more simple for the orthodontic team to
Yeah.
navigate safely through the pandemic, because
Mm.
we've got several more months. The vaccines are being approved by the
Mhm.
FDA, and we'll have that protection, but it's going to take a while to accomplish the level to reduce the risk in the orthodontic office that we can get back to the new normal.
Definitely. Well, thank you so much, Jackie. I think this is really great information, and hopefully we've dispelled some of that confusion and made it not such a daunting task. So
Mm.
we will be back next week with the next episode of In the Sterilization Room with Jackie. In the meantime, to catch up on past episodes or to check out the latest orthodontic industry news, visit our website, orthodonticproductsonline.com. Until next time, take care and stay safe.
Thank you, Allison.
Thanks, Jackie.